Welcome to Empowering a Successful Home Treatment for Lymphedema Patients. This is a special Lympha Press webinar, and we're so glad you joined us. The words home treatment have taken on all new meaning. I mean, we've always provided intermittent pneumatic compression for at-home use, but in the era of COVID-19, things have been, as they said, unprecedented. Before we go any further, we want to acknowledge that those of you watching, whether you are referral sources or patients, well, everybody has been impacted by COVID-19. For some, it's just been minor interruptions in regular life and activities, and for others, sickness and even loss, and our hearts go out to you. We have messages of hope today for those with lymphedema and those who treat lymphedema. But we first want to acknowledge the stress, frustration, and the challenges these times have presented for all of us. And through that pressure, a pearl emerged with Lympha Press. And that pearl was genuine care for the people we treat, the referral sources we work with, for our employees. Genuine care that really sustains us every day, helping us to make lives better for people. And long after we can thankfully put COVID-19 behind us, will win the day. I want to introduce our panelists, and we thank you so much for giving us your time today. We know it's valuable, so we want to get right to it because we have some good information for you. Karen Ashforth is a renowned practicing lymphedema therapist who is going to offer practical steps on implementing a successful home treatment program. Deborah Gross is the International Clinical Marketing Director for Lympha Press, and we're going to begin our conversation with Eric Ansart, who is Lympha Press USA's president. Eric, what were Lympha Press's priorities back in early March when we all got this news that life was going to be different?
Yeah. Well, first off, thank you, Brenda, and thank all of you for attending. You know, I think in a lot of ways we have a real advantage in the fact that we are an internationally distributed organization. We are, Lympha Press is distributed in 37 countries or more around the world. And while my personal responsibility is US distribution, we had an opportunity to really see how the world was responding to this COVID situation early on and make adjustments. So from our perspective, our number one priority is always the safety and well-being of our team, our staff, and the patients that we serve. So that was a big part of our initial response.
Aside from, how did you practically look out for the safety?
Yeah, great question. So initially, our first response was we knew we needed to, and for those of you who remember, just a couple of months ago, it seems like years ago at this point, and so much has changed in hindsight. But initially, there was a lot of uncertainty about how long the virus would sit on, paper boxes or plastic, and so a lot of conversation about how we manage safety and precautions. So I'm grateful in hindsight that we took a lot of precautions that at the time seemed extreme, but in hindsight were actually were well suited. So initially what we did is we took and we quarantined every box that came into our warehouse for 10 days just to make sure that there was no chance that anything would be, no cross-contamination would take place. We obviously started monitoring the health and safety of our own staff. We created social distancing barriers and increase the amount of cleaning and cleanliness between shifts and even throughout the course of the day within our operations department. That was all really set up to make sure that we were taking care of the people who were within our team, but also that we knew that there was an impact that would happen to the patients that we were serving. So we really took a three-pronged approach to this. Was number one, we wanted to make sure we were taking care of the safety and well-being of our team and patients. Secondly, we wanted to make sure at that time we didn't know how this would impact international distribution. So we made a decision at that time to bring an added amount of inventory into the United States just to make sure if there were issues with flights or boat transport that we wouldn't be impacted by that. And probably the third, and I would say the most important part of this, was determining whether or not we were essential in the response to the COVID situation. Obviously, from a governmental perspective, we recognize that we were considered essential as being a DME organization, a medical distribution company and manufacturer. So we knew we had the rights to be open, but we really wanted to find our place in helping the patients. And we made a decision early on that because lymphedema patients are so susceptible to reoccurring bouts of cellulitis and infection, that we felt it was very important to maintain our business and continue to operate through this period of time so that we could serve our patients and we could be there for our clinical staff. So we made those decisions really in early March, and we've been able to continue those operations to this day.
It was really remarkable how everyone rose to the challenge. And there were benefits to us being an international affiliate because, well, this all started in China, Europe, and how did being international benefit us in this scenario? And perhaps you want to jump in as well, Deborah, on that question.
Well, Lympha Press products are manufactured at Nego Afek in our corporate office in Israel. So, so we're like in the middle. Israel got hit with COVID early on. They put in very, very aggressive measures to stop it, and they've done a really, really great job. There's very, very little infection going on right now. They did a very aggressive contact tracing and quarantine measures. So thank goodness everything there is going well. Now, the factory is located in a very rural area of Western Galilee, so that when you step outside, you see these beautiful Galilee mountains on one side and then fields on the other side. It's an absolutely lovely, big outdoor space, very beautiful. So when the COVID issue first hit, as Eric said, our first concern is to be able to meet demand for our customers. And when it first hit, we just took really, really aggressive steps to secure the supply and the production of our products to all of our customers. We moved to shift work to enable social distancing, and we broke up into small groups. Each group is working separately. And so what happens now is that the factory is working basically from before dawn. The lights come on and then they only go off like towards midnight. So we're working in shifts and really almost around the clock. And as Eric said, we sell our products over the world. We're seeing increased demand from all over the world. We have requests from therapists in Scandinavia and Germany and Asia for systems to help patients maintain their condition, and in a lot of cases even initiate treatment. So we really are doing whatever we can, and it's a busy time at the factory. And we are really, really glad that the methods that we've taken have enabled us to meet the increased demand. And so far, so good.
Yes.
We're doing great.
You know, and I think it's an interesting juxtaposition to see the exterior of where the manufacturing plant is and how rural and farmland it looks. But inside, oh my goodness, the cutting edge technology, world-class technology happening as you manufacture Lympha Press, the leading pneumatic compression therapy on the market. And so thank you for your efforts in that. I want to get right to our content. And one of the things we did as a company was realizing education is an important part of our mission. So rather than being able to in-service our referral sources or be in patients' homes, we turned to webinars. And one of the most widely viewed and engaging webinars was one that Karen Ashforth produced for us, and she is going to replicate it now for all of you, which is about empowering successful home treatment for lymphedema patients. Karen, thank you so much. We are on the edge of our seat because we know this is great information for both our referral sources and our patients.
Thank you so much, Brenda. It's such a pleasure to be here, and I am very excited to share a lot of information about being able to treat creatively in this time of COVID. I personally was affected as a clinician because my clinic closed down due to quarantine measures on March 30th. So I did a combination of reaching out to patients through telehealth visits and also transitioning many of my patients to home health. And that really opened my eyes to the pros and cons and all the different ins and outs of how to treat patients when they don't come to the clinic. what I found was that really home health was the best option because I could put my hands on my patients, and the treatment was a lot more as it would have been in the clinic. But even with the telehealth patients, I found that though the downside was that there was no hands-on, that I could do a lot of education, and the ability to view my patients through the telehealth was helpful. So I would say that for remote treatment, either way, the real emphasis is on education and patient responsibility, even more so than in the clinic treatment. So I'd like to start by just touching on the German gold standard of lymphedema treatment, which is a complete decongestive treatment. And the components are manual lymphatic drainage, compression bandaging and garments, exercise, and skincare. And I'd like to talk about how it's possible to modify this to assist patients who can't come in for treatment. Again, I'd like to discuss how not every patient is appropriate for telehealth. The patients and the therapists have to be flexible, and the patients have to take responsibility for their own treatment. There needs to be very clear education and a comprehensive home program with plenty of resources, and not all patients are appropriate for telehealth visits. This is a model that I developed as I was navigating my way through. And on the left, you can see conservative treatment, which is compression, exercise, and elevation. And on the right, lots of education in manual lymphatic drainage, risk reduction, skincare, tracking symptoms. And I discovered that using pneumatic compression became an invaluable part of my treatment, especially in cases where I couldn't put my hands on my patients. So I'm going to go over each of these categories, and as we discuss compression, in the traditional CDT, there are two phases. There's a reduction phase that is traditionally done with bandaging, and a maintenance phase, which is done with compression garments. The difficulty in remote treatment is that compression bandaging is very difficult to teach remotely. And for patients who are already established, that's not as big of an issue, or with home health. But I've had to rely on other options and have found that the Velcro wrap garments and pneumatic compression can really assist in this part of the reduction phase. Exercise is a critical component of any lymphedema home program, whether it's range of motion, whether it's functional exercise such as walking or breathing. And all of these can be taught hands-on or remotely and can be followed up in that way. So this is a critical component. Elevation becomes very important, especially for our lower extremity patients. And you can see that I've included a graphic where just say no to recliner chairs, especially for sleeping, because many recliner chairs cannot elevate the legs higher than the heart. And so the legs remain in a dependent position night and day. And I've gotten creative using pillows and bolsters to elevate legs, to be able to use more exercise in combination. And again, as much as possible, educating patients of the importance of sleeping with the legs elevated as much as possible. But sometimes this is difficult with our patients who have sleep apnea or asthma, back problems. They may really find that the recliner chair is more comfortable for them, and that's why they're doing it. But when they understand what it's doing to their legs, then we can start looking at other options. Self-MLD is important for every patient. And for patients who are already established, who know the full MLD program, usually I just do some tune-ups. But for brand new patients, it is important to do a lot of education about lymphatic anatomy and function so that they can understand the importance of the lymph node groups. And I teach two styles. I usually start with a very basic self-MLD, which is just looking at the regional lymph node groups. I want to credit Gunter Close for this wonderful poster, which I use every day in my clinic to educate patients about their own lymphatic anatomy. And this is a very, very important part of daily home treatment, whether it's using it in conjunction with pneumatic compression or doing a full MLD session. Being able to activate the lymphatic regional lymph nodes is very, very important. Risk reduction education is also a backbone of my treatment, and I teach every one of my patients the various lymphedema risk factors. We talk a lot about skin care and discuss cellulitis, how to identify it, how to prevent it, especially for patients who have had repeat infections. A new free smartphone app is very valuable in being able to communicate between the patient and the clinician. LymphaTrack looks at symptoms and treatment, and the patient is able to enter all of these at home and send the data to the clinic so that we can track what's going on in the home program and be able to fine-tune things. These are all the symptoms that can be monitored, which can be really valuable if the patient is not coming in on a regular basis, either because of quarantine or because they have been discharged to their home program. Being able to keep track of all of these is a very good way to alert to a cellulitis infection or some other problem that may need to be addressed. Also, many types of home treatment can be recorded, and on the left you can see a graph where the information can be plotted so that you can visually see compliance and other factors in how the home program is going. So now I want to shift gears just a little bit and talk about my personal history as a lymphedema therapist. I've been an occupational therapist for 39 years, and 17 years ago I did my CDT training. And I was very, very manual based initially, and really was very wary about pneumatic compression because my understanding of it was that it could be dangerous. And it wasn't until one of my breast cancer patients participated in a study at Stanford and was using pneumatic compression. At that point, she came back to me and told me how it was really helping her. So I decided to investigate it. And from then, I started incorporating it more because it really made sense. It really did help my patients in ways that other modalities could not. So I'm going to talk about all of the different components that I just mentioned in how I do remote treatment, whether it's a new patient or an established patient. And I feel like in terms of using telehealth, it's better for the established patients if possible. It can be used for new patients, but it's not the best option because I really like to put my hands on the patient the first visit to really be able to teach them the self-MLD and do the palpation that is important to start out. Sometimes that's not possible. So being able to be creative, as I mentioned before, is important in the flexibility of this treatment. New patients need education, no matter where the setting is, whether it's in the clinic or whether it's remote, and they need to have their home program tailored to their particular disability. It's very important to discuss risk reduction for lymphedema and cellulitis, and new patients need a lot of visits at first to be able to reassess and expand treatment. What I found with new patients is that because we can't always teach everything in hands-on if it's remotely, pneumatic compression has an important role because if the swelling is not adequately controlled by all the education and the patient's efforts on their own, that pneumatic compression can step in and provide a very valuable service. For our established patients, we need to reassess their current symptoms and see how their home program is going. Is there anything new that we need to add to the program? And again, in many of these cases, pneumatic compression may be a godsend for patients who are struggling and trying to control lymphedema conservatively, using exercise, elevation, using their compression, and even doing manual lymphatic drainage. But if that's not successfully controlling swelling, then pneumatic compression is an important consideration for helping these patients control their lymphedema independently at home. So, is the current lymphedema treatment being effective for patients? For a new patient, of course, we want to give them a trial. We want to have them launch their program and go for success. But if there continues to be uncontrolled swelling, then pneumatic compression needs to be considered as an avenue to help patients control their lymphedema at home. So, for those of you who have never heard of pneumatic compression, it provides a lot of different things for lymphedema patients. It helps to decongest and compress. It helps to prevent cellulitis and wounds. It's actually one of the very easiest ways for patients to treat themselves. Personally, I found in my clinic that patients have a very high compliance rate, and that has been borne out by other studies. And I think very importantly that pneumatic compression is associated with reduced healthcare costs. I see a fair number of lower extremity patients who have recurrent cellulitis infections, and pneumatic compression has been studied and shown to decrease the incidence of cellulitis. And I've seen that play out in my own clinic. When patients are able to successfully decongest and compress their lower extremities and even upper extremities, they have fewer infections. Same thing with wounds. I deal with a lot of patients with wounds, venous leg ulcers, diabetic ulcers, and being able to have that advanced form of compression can be very valuable in accelerating wound healing and preventing reoccurrence of new wounds. Again, as I said, patients are very compliant with pneumatic compression because it's easy. And for patients who have limited range of motion, strength, dexterity, pain, if they have a lack of caregiver support or profound damage, pneumatic compression can be a very critical part of home care. This is just a study that showed the reduced healthcare costs with pneumatic compression, and that's something that patients appreciate, is preventing problems. A big question that many people ask me is, how much pressure do you use? And I find that most of my patients do well with mild to moderate pressure, and that I titrate the pressure to a point where patients are feeling comfortable but no discomfort. So it's important to do a trial in the clinic if possible, but it can be done remotely to be able to help the patient find that right pressure that helps them. Some patients need more than others. It depends on the amount of swelling, the amount of fibrosis, and this is a poster that I would love to make available that I developed with Drs. Mouse and Shingali that discusses the amount of pressures to use for various diagnostic categories that could be helpful for clinicians. So in talking about pneumatic compression, I think it's very important to touch on how not all pumps are created equal, and that many pumps have long cycle times, which actually can create pain with pressure, and the pressure may have to be reduced to a level that's barely therapeutic in order to prevent pain. Many pumps have a very limited pressure range, and so it can be difficult to treat all the patients in your caseload with one particular pump. I have made it my business to investigate every pump that I possibly can, and to find out the strengths and weaknesses and what pump works best for which patient. And using appliances, I think, is one of the big things in terms of does a patient just have swelling in the arm or leg, or do they have swelling in the body? because some pumps only decongest the arm or leg. And if there's damage to the lymphatics in the body, then it's important to choose an appliance, a pump that has the capability of an appliance that can cover the torso or the abdomen. Some pumps only have sequential programming, which can be problematic for some patients in terms of pain. And most pumps have chambers that are just welded, they're not overlapped. I'm going to show you a graphic in a minute, which illustrates how overlapping chambers are very important in pneumatic compression treatment to move the fluid completely out of the area. And also, most pumps have a limited deflation. It could create a tourniquet effect or pain, poor edema movement, and being able to deflate completely allows for good lymphatic uptake. So talking about Lympha Press, I really found that as I was using many pumps, I kept coming back again and again to Lympha Press because there were just so many features that benefited my patients. And here are many of them. Lympha Press is very comfortable. It has a short cycle time, it's got a greater pause time, and many of these are adjustable, and this provides rest between the cycles, which is invaluable for patients who have wounds or neuropathy. There's a complete deflation in the appliances, which facilitate lymphatic uptake, and a wide range of pressures. I can dial down very low for patients that need comfort, or I can go up high for patients who have high body mass, they have a profound amount of fibrosis, and so no matter what the patient need is, there is the ability to tailor it for them. The appliances are very easy. They are the easiest I've found to put on, to take off, to clean, and they inflate to fit. So I know that the treatment for my patient is going to be reliable each time. It's not going to depend on how successful they are in closing the appliance with Velcro. And being able to treat proximally is very important for many of my patients. Again, overlapping chambers. It follows the principles of bandaging so that you don't have gaps in pressure, and it prevents the trapped edema between chambers. Helps to also prevent reflux and dermal backflow. This is just an illustration. You can see that this patient has not bandaged themselves successfully. There are gaps. And this is exactly the principle of what happens when you have chambers that are not overlapping. In contrast to Lympha Press, which has, you can see a 30% overlap in these chambers. So just showing you the different appliances that are available, just a selection of, this is very appropriate. Lympha Press is one of the few companies that has appliances that actually treat genital lymphedema. And many people are concerned with just using leg-only sleeves when people have a compromised proximal lymphatic system. This is a tremendous treatment. Also being able to treat people that are large-sized, having an appliance that is specifically designed for bariatric patients. And in particular, I love the upper extremity appliances because there is a specific chamber that treats axilla swelling. So it inflates right up into the axilla, which is a very, very effective treatment for many of my breast cancer patients and other upper extremity patients. I would say, again, Lympha Press has the easiest appliances for patients to put on. They have zippers in the right place, they're adjustable straps, and I can adjust the appliance for the patient, and then all they have to do is zip and unzip, and it's ready to go. Patients can also adjust themselves if their size or their needs change. And I think perhaps the most exciting thing to me as a therapist is that Lympha Press actually increases lymphatic function. And in a study that Melissa Aldrich did in 2016, she showed that there was significant lymphatic vascular movement and increased pumping velocity in the affected side. There have been other pumps that have been studied with ICG, but no other pump system has shown that they can increase lymphatic movement in the area of treatment. So this is just a video that shows you on the left. They made some special sleeves that were clear plastic that you can see here that it's pumping, and then on the right you can actually see the lymphatic movement. Very, very exciting. So I'm going to close my portion by showing you on the left, this patient had had CDT, she'd had manual lymph drainage, she'd had bandaging, she was currently using a Velcro wrap for maintenance, and she was not successful in managing her lymphedema. On the right, you can see how this changed. This took a while for her, but using pneumatic compression allowed the leg to reduce enough that she could actually get in and out of bed by herself instead of having her husband lift her leg for her. And she was developing wounds as she dragged her limb across the bed, and this increased the quality of her life, her ability to walk, her ability to care for herself in a way that just wouldn't have been possible otherwise. And to sum it up, I would say that being able to use Lympha Press to treat lymphedema and prevent fibrosis progression is a very, very important way of preventing debility and improving patient lives. And I'm excited to be using Lympha Press systems. I feel they have the best range of pumps and appliances to treat our lymphedema patients and empower them to the highest function.
That was inspiring. And we said at the outset of this webinar that we were going to offer hope to lymphedema patients and to those who treat lymphedema patients. And the photos don't lie. I mean, some of the people watching today may not have such extreme physical circumstances there, but to see the reduction, to see the improvement. Thank you so much, Karen, for sharing that important information. And aside from what we wholeheartedly agree with your statements about Lympha Press and the product efficacy, the other component of that that people care about is, will people be treated well? Will they get great customer service? Is there a team to back it up? And one of my favorite visuals from this whole COVID-19 experience, when none of us could leave our home for a period of time, I photoshopped every member of our team into one slide because we were all working remotely. We wanted to keep serving our patients, so we pivoted to remote work. And everybody was photoshopped together, and the visual says, the pandemic was no match for our mission. And I think that rings true. We kept at it, and we continue to try to make lives better for people. So I don't want to monopolize the conversation here. Eric or Deborah, do you have any comments you'd like to make about the great presentation we just heard before we open it up to questions and answers from the audience?
I'm looking forward to the question and answer section. There's just one comment I wanted to make. And first off, Karen, thank you for reviewing that information. It was great. And you mentioned the gold standard of what was done in a lot of the German clinics for the treatment of lymphedema. And I think that's really been an advantage of Lympha Press for the 40 years that we've been in business, that we can draw on the experience of the world and bring that technology into a patient's home with a very easy to use device. So thank you for taking the time to do that. And I'm looking forward to hearing some questions from our audience.
Yeah, and Deborah, you were integrally involved in that study that showed the IC green and how Lympha Press, well, the proof was in the visuals. Can you just make one statement about that before we go into the Q&A?
I was really excited that we could do this study. That we were the first pump to ever show the pump is effective at moving lymph fluid, at increasing lymph fluid uptake in the affected extremity. There have been studies done showing IC green with MLD and with other pumps, but this is the first ever study showing actual treatment effect of the lymph system absorbing fluid and moving it during treatment, and you can see it in real time. It's just really, really exciting.
It is exciting.
You
I
know,
want to, yeah, go ahead.
I was just going to say, before we move on, one of the pieces that has always excited me about that study that sometimes I think we overlook just because there was such a significant understanding that we were moving proteins is just, it happened not only while the device was being used, but it happened for the entire time that the patient was monitored afterwards. So for the hour that the patient stayed on the camera, we continued to see lymph movement. And it was an increase of velocity and frequency of the pulsation of the lymph protein. So it's just it was such a hallmark paper, I think, from an industry perspective, that sometimes we miss little pieces that were really, if that had been the only outcome of the study, I think would have been monumental.
Yeah, really good stuff. So we are excited to not just have a monologue here, but we want to hear from those of you out there watching. We're so glad you've given us your time. We hope you've learned something. We hope you've been inspired and have some hope, but we also hope you have some questions. So bring them on. We're ready to answer.
Thank you, everybody, for hanging in there with us. This has been, excuse me, so interesting, even second time around. Big question, a lot of people asking, how do I have access to this information after today? Would you like to answer that? I know, Eric, you know this is going to be living on the LE&RN website for one thing, right?
Correct. Yep. We're grateful to LE&RN to actually have this opportunity. So this will actually be on the LE&RN website. If you reach out to us, we can definitely provide you PDFs of specific portions of the presentation if there's something that you're looking for, but this will be on the LE&RN website.
Wonderful. And also Lana Berkovich, we're so glad you were here today with us. She specifically wants your poster, Karen, so we're going to make that available to her as well, because you made that available to all of us. There was a question about overlapping chambers, and someone said, I don't really see the benefit in that. And in my limited knowledge, I know that backflow and gaps can be alleviated by overlapping chambers. Can you speak to that, Karen, for us?
Sure. I have used, as I said in the presentation, many, many different types of pumps. And I have found that the pumps with the welded chambers, that I will actually see the skin looks different between where the chambers were, because it's not getting the same amount of pressure over the weld. And if you've ever used a quilted garment, for instance, you can see that there is often little ridges and different things. And that's a little different because those are negative channels that are going in the flow of lymph. But when we're talking about horizontal areas where the fluid just isn't moving the same because it doesn't have even compression, I really feel that in my clinical experience, we're getting a better treatment when we're overlapping, just like we do when we bandage. And you can see from the illustration that I presented earlier that when you have gaps in compression, you get swelling poking out through those areas. And I believe that the same happens in my observation with the non-overlapping chambers.
Got it. We had a lovely comment from Veronica Seniores. Thank you for being here, Veronica. And she just said, I don't have any questions, but I just want to thank you for the presentation. And her favorite slide was education, education, education. And I think we are all completely in agreement on that. Thank you for that comment, Veronica. Haris Shankar, and forgive me if I'm not saying your names correctly. I'm giving it the Girl Scout try here, but he has a Lympha Press. And his question is, how do I know that the press is achieving the correct pressure? Does it need to be periodically checked by a technician? Who would like to answer that?
I'd be happy to answer that. So I think the first thing I would say is if you have any questions, we have a team of people around the country that would be more than willing to come back out to your home and take a look at the device and make sure that you're comfortable with it. So our service is certainly the first part of that. But you know, one of the things that I've seen really what attracted me to Lympha Press and working with them over these last 10, 12 years is we have units that have been out for 20, 25 years that regularly come in for a question or maybe a sleeve is worn out. So the device itself doesn't need to be updated or calibrated on a regular basis. It'll run for years and sometimes decades without service. So that shouldn't be an issue. But if you have any questions specifically about your unit, please reach out to us. We'll more than happily stop by and make sure everything's okay.
Great. Michaelina Frackleton asks, if a patient has had PEs and DVTs in the past but is on therapeutic medication, are they a candidate for the pump?
Karen, could I defer that to you as the only person here at the clinical?
Yeah. I would say that if somebody has any kind of a history of clots, that I don't feel comfortable doing any type of lymphedema treatment unless that patient is on anticoagulation therapy or has been cleared by their doctor because of the length of time of the history of the clot. So I think that as long as we have good medical oversight and we're working hand in hand with our physicians, there should not be any problems using any aspect of compression therapy with a patient that has any type of clot.
Wonderful. We have some patients out there or potential patients that are asking about insurance coverage. What is the price of this device, or does insurance cover it?
So I'll definitely field that question. So as those of you who've tried to get equipment or care in the past, you're probably familiar. It really depends on your insurance provider, and unfortunately sometimes even where you live in the country, because our national providers are broken into different regions. So really the easiest answer is that this is available for Medicare patients. We have a variety of different products, and when you become more familiar with the Lympha Press brand, you'll recognize that we've really taken the technology of our devices and driven that technology into as much of the equipment as we can. So you get really, really good benefits almost regardless of what piece of equipment you get from us. So the easy answer is it is available through Medicare. Most private insurances do cover it. Obviously, there's copays and deductibles that have to apply sometimes, but you can certainly get this equipment in most situations through your insurance provider.
Excellent. Now, this is a COVID-related question. Kathleen Listen asks, should we stop intermittent pneumatic compression if a client has been diagnosed with COVID? Is there a risk with increased blood clotting seen in some cases, seen in some cases of COVID?
Wow, Kathleen, I could always count on you for great questions. And I don't think we know enough about COVID to be able to give a definitive answer, because I am hearing new things about COVID all the time. But I would say that if the patient does not currently have clots, if they don't appear to be at risk for clots, somebody with COVID should not stop doing lymphedema treatment. And I think that using the tools is more important than ever. As far as starting a new treatment, I would be cautious for somebody who is fighting the pandemic personally. But for someone in an established program, I would just alert the medical professionals and roll with it.
Gotcha. Here's another COVID question, and it's like William Brown was anticipating you speaking about LymphaTrack. His first question was, do you have any knowledge on how tracking a patient's condition has been affected by COVID-19, and how are people able to check their state without a doctor at home? And then his follow-up is, what's the most important factor in the LymphaTrack device, in the app, for you to track as a clinician? So we're throwing a lot of questions at you here, Karen, and I know you're up for it.
These are great questions. And I'll have to say that our county has been relatively not too affected by the COVID virus. Even though we quarantined heavily, I think maybe that's a reason why I have not had a single patient with the COVID virus that I have known of. So I can't really answer the first part of your question. In terms of the second part, the LymphaTrack, it tracks so many different things that for me, it's about looking at the combination of what people are doing and how their symptoms are. I put the two together, and so I don't really have a single one aspect that I look for unless I have a compliance issue. But otherwise, I look more holistically at the entire program and the entire level of symptoms.
Could I add to that too? And one of the things I think when we were looking at creating the LymphaTrack program, it was really around creating connection between patients and therapists. And that's our goal, you know, with reduced visits from insurance providers or COVID-19, whatever it is, we've seen a decrease in the ability to treat patients over a longer period of time. So we felt like there was an important point of contact of just making sure that once that patient is discharged, or if they are home, that they can continue to stay in communication with their therapist and their doctor. So there's a very simple application on the bottom. You can hit the button. You can send your results over to your therapist 30 days, 60 days after discharge, whatever it is. And they can monitor those symptoms and kind of help you navigate the first few months or first few years of dealing with lymphedema. So there's so many aspects of good long-term lymphedema management and treatment, and we just tried to create a way of connecting patients to their therapy team.
And I have to tell you, it is so easy to use. I have it right on my phone here, and if I can use it, anybody can use this app. It's super easy and really helpful. And you're right, it is all about connection. One of the first questions that came in for the presentation, I want to make sure I get to it, is from Charmaine Kostreva. And she had used not a Lympha Press, but a different pneumatic compression device for long-standing lymphedema of the left arm. She believes it has caused some chest pains, and could that be related to the specific kind of pneumatic compression? I guess we would really need to see that patient to be able to speak to that, but I think it's really important that your point was not all compression is created equal, and the Lympha Press garments treat certain areas of the arm that not every garment does out there.
I'd just like to add that I think that it's really important for patients to not have any pain at all with treatment, and that I really emphasize titrating or adjusting the pressure so that the patient has both comfort and treatment. So I find that it's very important for me to do trials in my clinic before I recommend a specific piece of equipment, because that's a huge investment of time and money and insurance. And sometimes people do develop problems over time, and then they come back to me, and then we tinker with it a little bit. And so I think it's if there's a problem currently, it would be good to have that reassessed and get to the bottom of it. Why is that causing pain? And is there an alternative so that you don't have to have pain?
Excellent. So from Pamela Scarborough, Karen, do you take your patient's blood pressure and ensure the compression pressures are below the diastolic blood pressure? She has seen this recommendation somewhere and wanted you to speak to that.
Yeah, that is something that sort of appeared a number of years ago with a certain pump manufacturer as a recommendation. And I have never seen an actual study that has made a recommendation of taking blood pressure to determine the top pressure. Again, I titrate to comfort, and I look at the whole patient. I look at all of their symptoms, making sure that they're comfortable, and monitoring everything and taking everything seriously. So certainly if somebody has blood pressure issues, that could be something that could be done, but I don't do it as a matter of course with every patient.
Got it. When we spoke of home health, specifically, what did we mean by that? What did you mean by that? Do you refer to the patient's home care agency, or does the therapist go to the patient's home? Could you just clarify that for our listeners?
Well, I'm just going to talk about myself, and I was lucky enough that the outpatient hospital lymphedema clinic that I work at is also connected to a home health agency. And so I was able to transfer from being an outpatient therapist to being a home health therapist. And what that meant was that instead of seeing patients in the clinic, I was able to see them at home. So there's many different types of and forms of home health. The most common, I think, are the agencies that bill insurances, but there are also lymphedema therapists who work on their own and see patients at home. And when I worked at another setting, we had, fortunately, a number of lymphedema therapists who could see patients in their home, fee-for-service as a massage. And I found that to be very, very helpful. But what I think I was referring to in this presentation was the agency-based home health.
Got it. So Barbara Jacobson has a pump that is not a Lympha Press, and she finds it very difficult to don. We know how hard, if it's not easy to use, compliance is a real problem. She wanted to know if, and I'm not going to say the name of the product she is using it, are all the pumps pretty much the same in how they pump?
And is it just the benefit to have an easier garment to put on? I'm just sort of dancing around the question to try and find the best way to answer it. We've already established that Lympha Press is really easy to put on. So yes.
Right. Lympha Press is easy to put on, and it's easy to operate, and it's very, very versatile. And I have found that Lympha Press is more versatile than any other pump that I've ever worked with. So I found that it's very easy to tailor to patients. And if you were my patient, I would ask you to come into my clinic and bring your pump and set it up, and we would go through a treatment, and I would tinker with it. I would play with how you put on the garment, I would play with the settings, and we would try to see if there was a way to make it work for you so that you had an effective, comfortable treatment. If that's not possible, then I might start looking at alternatives. And is this the best setup for you? And would you be better off with a different setup? So I think it's all about seeing what works.
That makes sense. Now, my new favorite question that came in is about my new favorite topic, which is lipedema, not lymphedema. And the question is, could I use this device to help with lipedema management?
Absolutely. My lipedema patients love using pneumatic compression. It is very comfortable, comforting, effective, and I can't say enough good about it for treating lipedema.
And I'm just going to add a little commercial in there because, like I said, lipedema is a topic near and dear to my heart because I've been talking to lipedema ladies. 11% of all women in the United States or even internationally have lipedema, which is this painful fat disorder. And we have started a YouTube channel called Lipedema Ladies, where we tell the stories of these women who are very brave and are forging new paths of understanding and awareness about this underdiagnosed but very prevalent condition. We are delighted that the Optimal Plus, which is Lympha Press's premier device, is indicated by the FDA for the treatment of lipedema. So I really like that question. So Kelly Bell writes, I love the idea of remote meetings, especially with the backlog of patients trying to get treatment. I'm curious if there are any plans in the future to have the LymphaTrack app link to the Lympha Press pump app and also with other health and activity apps to import all the data into one app so that the info can just be exported to your therapist for review. It would make so much easier if we could track all data in one place. Kelly Bell, we are so glad you are out there. You're one of our favorite people too. He has served our country well. He has lymphedema, and he is definitely an advocate for the cause of lymphedema patients everywhere. Kelly, we're so glad you're there. Who would like to answer his let's put everything into one app and make it easy for everyone question? Is that on the radar screen for the future, perhaps?
Deborah, you want to take that?
Yeah, sure. It's a great suggestion. Now, we have the Optimal Plus actually has an app where you can send your treatment parameters and your compliance data to your therapist or whoever you want to, by phone. You can also you can retrieve the compliance data. You can also retrieve different treatment programs from your therapist. So, for example, you say, "Well, this isn't working out for me." Your therapist can either tell you what settings to put in, or your therapist can send you an actual treatment program that you can then use your app and on your phone and use your phone to actually change the settings in your pump to exactly what your therapist wants. So we're at the cutting edge here. We're the only lymphedema pump with this application and with the full compliance monitoring. Putting in the LymphaTrack is for everybody. You don't have to have a Lympha Press to have the LymphaTrack. You can just download it and track your lymphedema, even if you're just using compression stockings or having manual lymph drainage and traditional CDT. You can still use the LymphaTrack and select whatever parameters you want to follow, if it's MLD, if it's bandaging, if it's exercise, and your weight, et cetera, whatever parameters, and it'll track it for you. And it's all completely private. So I think it gives an added benefit just for the general lymphedema population. They don't have to have a Lympha Press to use it.
That's great. Thank you, Deborah. Kevin Nordberg asks, how long should each pneumatic compression session last?
That's a great question. And I tailor that to the patient. I have some patients who get benefit from a 30-minute treatment. I have other patients who need more towards a 60-minute treatment. So again, I think it's about doing a trial and really tailoring it to see what works best for the individual.
Here's another very basic but important question. Julie Waller wants to know, how do you clean the device or the garments? That's important.
Very easy.
I'll answer that. And Karen, you can talk to doing that in the clinic because that's also an activity that clinicians are concerned about. The easiest way to clean it is just take a sponge and do what we've now been doing since this COVID thing started. Get some rubbing alcohol, put it on a wet sponge, and just wipe over the surfaces on the inside and the outside. It'll come out clean and it'll smell great and everything. Just be sure you open a window because that alcohol smell is pretty strong. And it also dries really fast. If you have access to alcohol wipes, that is really the best for a clinic cavicide with 50% alcohol. It dries just really fast. And that's the really easy way. It's very easy to get super clean because it has a polyurethane coating on it that's not porous. So it's not going to trap pet hair or cigarette smells or stuff like that. It's impervious. So you just wipe it off like you'd wipe off like a plastic tablecloth, and it's clean and ready to go.
Excellent.
And in the clinic, if I could just say, I happen to be in my clinic, so I use my Super Sandy cloth, which is like alcohol wipes on steroids. And I'm very committed to making sure that we sterilize equipment in between patient use.
Excellent. We still have questions coming in, so we're going to try to get to as many as we possibly can. And Eric, if you need to bring out the hook and tell me to stop, I will, but I'm going to keep going while we still have questions.
Please do.
So Julie Waller had a follow-up question. What precautions do you recommend for someone who may be developing varicose vein?
So you can actually use compression to treat varicosities. So I wouldn't consider it a precaution other than just pay attention to comfort level. But otherwise, I would say you're doing exactly the right thing.
So there are continued questions about overlapping pressure and some concerns. So it says this one person, and we're so glad you're here because we love good questions and we want to answer them. Can overlapping create increased pressure at every overlapping area? Let us not forget that the patient is not moving during pump time, unlike when they are wearing bandages. There is no cushioning with the sleeve, therefore the pressure with overlapping, could it be damaging to the circulatory system? I think that's an excellent question and we're excited to answer it.
That is a great question. And I think that unlike bandaging, which is very static and firm against a patient, pneumatic compression is intermittent. And so you have this rolling pressure that's occurring. So you're not really getting any kind of a potential tourniquet effect or overpressure in any area. And I don't see the 30% overlap as an issue in terms of giving too much pressure because we're looking at the overall treatment and the overall comfort level. So I would say that even though we're using the principles of bandaging and patients are still, that the nature of pneumatic compression puts it in a different light in terms of how it plays out in actually putting pressure on the body.
I'd like to add to that the overlapping actually makes the pressure more consistent. If you don't have overlapping, then what you're going to have is you're going to have areas where you have trying to show it, like you have pressure here, and then you have pressure here, but in the middle you don't have anything. So overlapping is what's going to keep that pressure nice and even, just like in a bandage. And again, it's intermittent, it's going to release and then it's going to press. And the chambers overlap in such a way that the overlapping part is actually going up. So the pressure goes up, it's not pressing down harder, it's actually just inflating upwards because of the direction of the overlap. I think it's something that you have to try. You have to actually put the pump garment on your arm or your leg and just feel that it's very, very smooth. You don't feel, it's actually smoother, much smoother than non-overlapping chambers. It's a very, very smooth massage motion, and I think you just need to try it to experience it.
One of my favorite names that showed up here is someone who goes by Guerrilla Warrior General. So he's definitely a lymphedema advocate. I just know it. But his question, and he had a few comments, one that was very nice about his personal experience with Lympha Press and its efficacy. What is the anticipated lifespan or life cycle of this home therapy system, the Lympha Press system?
Wow, I have had units that I use in my clinic every day that I've had for over 10 years. And I know that many insurances will replace the system after 5 years. But I've used lots of different systems, and I have some Lympha Press systems in my office, but I get a lot of other donated ones because they don't work for patients, but they want to pass them on to someone else that maybe doesn't have insurance or means to buy something. So I get to observe a lot of different types of systems, and this is totally unscientific, but my observation is that Lympha Press really lasts. And I see other systems wearing out a little faster.
People continue to ask for your poster, Karen. So we're going to make sure that if you give us your email addresses, we will get that poster out to you. Question from 1+6T. Compression garments should be custom made or standard ready to made? Which one would you suggest? And I think that depends on the patient.
Yep.
Okay. And Barbara Jacobstein, I've been told that I have 2 ventral hernias and no pain. Could I use a pump with the abdominal hernias not needing surgery yet? Again, we don't want to get into diagnosing anything without seeing a patient, but does anybody want to speak to that?
I think that's a question that needs to be asked to a physician, because I think if you were my patient, I would certainly be on the phone to the doctor and talking about whether that's something that would be safe.
Perfect. Are stockinettes recommended for use with the garments?
I use garments over clothing. I use them over certain compression garments. I use them over stockinette. In my clinic, I use pillowcases. I think that it's very important to have a barrier so that you don't have the garments directly on skin. And there's many, many different ways, and stockinette certainly is one good way.
What are setbacks for improper use of the pump? And one of the things we want to say is that we personally make sure that everybody has their first therapy with someone fully training them how to use it. So we try to avoid any mistakes by just simply providing good training for the use of it. I almost don't even want to speculate if you use it wrong, what could possibly happen. But it's so easy to use, I gotta tell you. For the leg sleeves, you just zip it up, hit a button, boom, your therapy begins. It's easy, it actually fits to fill. So there's really not a lot of space for human error, in my experience. And I have to tell you, my boyfriend has a Lympha Press. He has lymphedema, so he uses it all the time. So I know it's easy to use and it's easy to clean. Does anybody else want to comment on the human error aspect and using it wrong?
I love to troubleshoot.
Yeah.
Just a short comment. We have tamper-proof mechanisms on all of our pumps, so you can the treatment can be locked in, so that somebody can't, just a tamper-proof mechanism to lock in the treatment parameters for all of our systems. Sometimes it's a manual lock, and sometimes it's a digital command that you put in. So we have that to prevent somebody accidentally or unintentionally changing the pressure.
We had a great comment from Catherine who said, I had a Lympha Press from 1990 and it lasted for 15 years. So
Wow.
it's Toyota.
Yeah.
Right? Thank you, Catherine, for that comment. Some folks with lipedema are asking about rebounders. Should I do that before or after pumping, Karen?
That's really a good question. I would try it either way. I think, that, again, that's an individual thing.
And then there are other questions from people simply hearing this and are saying, how do I get a Lympha Press? And we suggest, they're saying, do I go to my doctor? And the answer is yes, right?
Yes. Yeah, absolutely. Probably the easiest way is to just reach out to us and we can put you in contact with somebody that can give you the necessary information. Just so much easier if your doctor gets a little concise note with exactly what they need to document, and we can kind of facilitate that easier for you.
Pamela Scarborough wants to know, can you use compression devices over compression wraps?
Again, it's an individual thing, and I would try it out in the clinic first and make sure that that was working. If the wraps are done evenly and properly, shouldn't be a problem. I would say that sometimes, like the Velcro wraps, you can get little indents in the skin because of the way that the wraps overlap. So it's really an individual thing where I would just want to see how much pressure we're using and how the wrap was fitting and whether it was applied correctly.
Got it. Lana Berkovich wants to know if we can provide a little bit more detail about the IC Green research study. And I know that Deborah, you were a key in the development of that study and the results. Would you like to speak to that?
Yes, we did the study at the University of Texas in Houston with Dr. Caroline Fife and Dr. Melissa Aldrich, and we took patients with lymphedema, and we injected them with IC green dye, and then we looked at the flow of the IC green dye with no treatment, and then before, during, and after treatment with the Lympha Press. And so the interesting thing about looking at these patients before treatment with no treatment with the IC green dye is you could really see the extent of lymphatic damage. Really, you can just see that the lymph fluid is not moving. And then when you put the Lympha Press on them, we had a clear sleeve that you could actually see in real time the pump action over the leg and how it was moving the fluorescent IC green dye. So you put on the Lympha Press and you turn on the black light, which causes the IC green to shine like a fluorescent light under the skin. And we could actually see how the lymph vessels were actually taking in the lymph fluid and moving it. You could see lymph vessels recruitment of lymph vessels that were not active before the treatment, all of a sudden lighting up because now they were working to pump the fluid. We could see the actual speed of pumping increasing during Lympha Press treatment. And also when we videoed the leg after treatment, we could see that the actual speed of the pulsations of the lymph vessels was still increased over the baseline without treatment. So, and this effect went on for like 20 minutes after treatment. If we had kept checking it, then we could have seen it go on even further. So there is an actual increase during treatment and also after treatment because we've primed those lymph vessels. We've gotten them to start pumping with a Lympha Press treatment, and then even after treatment is over, it's going to continue pumping for a while afterwards. Just like you can probably see with an intense MLD session as well. You've activated it, and then it's going to continue working. So we were really, really, absolutely so glad that we could capture this in real time where you can actually see the pumping. If you go online and look at the article, there's videos there that you can actually see of before, during, and after treatment. And you will see that actually before treatment, there was very little flow. So these are not normal controls. These are actual patients with lymphedema. And it was just amazing to see how well the treatment worked.
Well said, and a great synopsis of what was a groundbreaking study that really shows how Lympha Press works. We are really getting to the end of our time here. We want to thank those of you who have so graciously stuck in there with us. We have tried to answer as many questions as possible. Eric, I'm going to leave it to you to wrap up. And if any of our panelists would like to have any closing thoughts, now's the time to do it. But most of all, thank you. Lympha Press really cares about the referral sources we work with and the patients that we treat. And together, we're making lives better for all of you. So Eric?
Great. Thank you, Brenda. Karen, thank you so much for your presentation, and Deborah for your comments, and your work on that study was tremendous. We just want to really end with a thanks for the LE&RN organization for the incredible work they do in sharing lymphedema education and research and really advocating and lobbying for change. So, you know, this was an opportunity for us to be able to present our response to COVID-19, but probably more importantly, to be able to share some of the information that we believe goes into a successful home treatment program. So for all of those of you who did join us or maybe are watching this afterwards, thank you for joining us. Thank you for taking the time, and hopefully you found this time worthwhile for you. Thank you so much.
Thank you. Have a great day, everyone.